And welcome to the Wednesday, March 10th, 2021 virtual Zoom meeting of the Littleton Board of Health. Just going to read the Zoom. Are we still reading the Zoom rules? After
Yes, please.
You didn't record that a long time ago.
The town of Littleton began conducting remote participation / Zoom meetings pursuant to Governor Baker's emergency order suspending certain provisions of the open meeting law on March 19th, 2020. Since that time, unanticipated legal concerns related to the open meeting law have been brought to our attention by the town clerk. These concerns are supported by the Attorney General's office and confirmed by town council. One concern is that the chat function allows a parallel text conversation to the board's public meeting. Chat is essentially running commentary that is occurring but is not moderated or followed by the chair. All participants and listeners may not be aware of comments being made because some meeting participants join by phone and do not see these conversations. Another concern is conversations between residents within the chat room which are not incorporated into the public record. In response to these concerns, the town will implement the following changes, which in no way prohibit any member of the public from participating in discussion and sharing information during the public meeting, and will ensure that all listeners and participants have equal access to this meeting. People that join the Zoom meeting are set so their microphones are muted. If you call in by phone, please use *6 to mute or unmute your phone. So that the meeting can occur in an orderly fashion, we ask that people who join keep their microphones on mute so background noises do not interfere with the meeting. If you wish to participate in the meeting, please use the raise your hand function available on Zoom. If you call in by phone, dial *9, which will activate the raise your hand function. The meeting host will notify the chairperson of the raised hands, and the chairperson will determine whether and when to allow public comment. When called upon, participants should unmute, then state their name and address. And after speaking, we request that the participant return their microphones back to mute. All right, so start off with the COVID update. You ready, Jim?
Sure. So as far as numbers goes, let me just turn my video on here.
Thank you.
As far as the numbers go, they seem to be the 2-week rolling average seems to be the same for the 3rd week in a row. You're at about 17 as of this morning. I sent that information to Mike so he could provide it to Katrina. Probably the biggest thing that changed today, and I got a little bit of an inkling of it before the governor's press conference, is the registration for vaccinations. It sounds like to hopefully try to avoid the crashing systems where everybody tries to get an appointment Thursday mornings when the appointments drop. They're going with starting the 12th, so starting Friday, so there'll be one more Thursday of appointments. But starting the 12th, they're going to go with a pre-registration system. Sounds like new software and pre-registration system, and that's for the 7 mass vaccination sites to start with. The idea is that you go online and register, and then the system tries to match you with an appointment when one is available that's nearby, sends you a message by your choice. Then you get to accept it within 24 hours. Instead of having to hit refresh constantly, it's going to come back and let you know when the system's going. So it launches, according to the information today, Friday. So tomorrow they'll drop about 40,000 new first dose appointments. I think they're at a point where they're still trying to catch up with the second dose appointments. So a lot of the vaccine that's coming in the state is being directed in that way. Again, the new pre-registration system will have the mass.gov COVID vaccine website that you'll launch from when it is up and running. And from what the press release from the governor says, you can still use the vaxfinder.mass.gov to book appointments if you prefer to. That challenge of seeing if you get lucky and get an appointment. Yeah, that's right. Educators become eligible for appointments tomorrow. So that's essentially, from what we heard from DPH, just about everybody related to the school system, from the bus drivers to the custodians to the teachers. They're all eligible to receive vaccine tomorrow. Now, given the constrained supply in the state, just like every other launch of a new group, I'm sure it will be a frustrating day of people trying to get appointments. Just because there's way more people who would like appointments than can get appointments. In addition to the state site, Some of the CVS locations are part of the federal vaccination program, so they're not reliant on the state's allocation to get vaccine. So they, in addition to trying the state site, some people may try the CVS sites too and see if they get some success in that regard. Again, this new software for pre-registering is right now is for the 7 mass vaccination sites. They're hoping to loop in the rest of the vaccination sites in the state as they roll this program out and hopefully have success with it. They're going to have, according to the state, they're going to have 4 educator days where they kind of dedicate, and these again are at the 7 mass vaccination sites, where they dedicate the appointments to educators. The 27th of March, the 3rd, the 10th, and the 11th of April are the dates that were up on the press release today. And in these cases, for those appointments, the press release says individuals must use the pre-registration site. So that means they need to register Friday or after for an appointment. I don't know if there's any questions on that.
I don't know if I heard this wrong one time. A statistic that said that we've already vaccinated more people in the state than there were cases in the state. Have you heard that?
Last I knew, there were more than 700,000 people who have received first and second doses. Mm-hmm. So if that's the case, yes, more than have tested positive for it. Mm-hmm. And I think we're probably 2 million or just over 2 million have had their first dose. Mm-hmm. And that number, again, if the Johnson & Johnson came on quick, that number may, the fully vaccinated number may come up pretty quickly if we get doses of the Johnson & Johnson.
Yeah, that's just one. Yeah, that's awesome. All right, anybody have questions for Jim? Go ahead, Gino. You have to unmute yourself, Gino. Gino, you have to unmute.
Thank you.
Hey, Gino.
Jim?
Yep.
Okay. Is there any way we can get, the school approached me and they were asking, I said, Gino, is there any way we can get another 300 vaccine for the school, for the teachers and everybody that works there? They need about 300.
So at the Department of Public Health meeting, Tuesday afternoon meeting for boards of health, and on the calls that I have, that because we're a district, the district call today, it was pretty clear from the state that they're not providing any vaccine to local clinics. So I think the short answer is no. They're going to be responsible for going or obligated to go to these mass vaccination sites as others in the state.
There's no way they can get it done at the school. I mean, right here, there's only about 300 people there.
No, but there's like 300 or 400 in each community. And again, we were told that they're not giving out vaccine from municipal clinics. So,
I got it. Is there any way you can email me and let me know where they're going to be able to go so I can give it to the school and they will get everybody to go whatever place that they suggest?
Sure. So what I can do is I can send you the governor's press release from today because it spells out all of the changes for educators pretty clearly. Right.
I received the governor's email and he says to me he's doing the best. The question is, the school needs 300. That's what I'm saying. Is if I have an email, I can show them where to go.
Yep. No, the press release has all that information in it. The address for the new pre-registration site, the old address for looking up a site independent now. So and it tells you which one of the mass vaccination sites will be available for the teachers on those educator days also.
And you let me know what kind of a day it's going to be, right?
I will.
Thank you.
Yep.
Thank you, Chairman.
Anybody else have questions for Jim?
Just one. I happen to also see the the Department of Education's plan for open schools, at least start with K through whatever, and also try to align it with the shortage of vaccine. So all I have to say, Jim, is good luck.
No, I just emailed all of you. Something came in about 6:35 today from Secretary Riley, DESI Secretary, essentially explaining why the 3 feet distance is acceptable. It has a link to a study I haven't had a
Yes.
chance to look at, so I figured I'd send it all to you. So it's kind of right on top of your comment there, Mike.
That's
I'm sure the
fine.
secretary has all the answers you have for safe openings of school at 3 feet.
So we have it on that first graders know about this 3 foot incredible wild place they're going to be able to occupy, right?
Right.
Fine.
Well, I mean, and I think earlier I had sent a comment to you, and I don't know if this was done by design. The elementary, the first group's going in on the 5th, the second group's going in on the 28th. I don't know if that was intentional to leave 3 weeks just to see how it phases in and see if there's any increase in either students or staff cases.
Or parents.
And it may also be that they're phasing it in so that hopefully the vaccine supply is coming in at the same time. So you'll hit
Yeah.
more teachers as the process opens up.
Yeah.
They don't share that
Yeah,
information.
I don't know. I don't know if it's, I spoke to a friend of mine who's a teacher, and I guess they asked the teachers not to have it all done on the same day, so that if there are any reactions, they're not going to have a whole group of teachers out. So
Right.
they might be staggering, trying to get the teachers staggered. So
Well, and those dates I believe that I gave you are all Saturdays.
yeah,
So
so they have Sunday to recover.
yeah,
Sunday
kind of with that in mind. And the clinics I've worked at and conversations I've had with people when they come back for their second doses, nobody seemed to really have any significant issue with a first dose. I mean, the worst I heard was a sore arm, maybe a little bit of a fever.
Yeah.
So
It's the second one.
yeah. I haven't heard anything bad about that, but yeah, they say that that one can have more of a reaction.
All right. So everybody, Jim has to leave early. So any final questions or comments regarding COVID? All right. You mind staying on until 7:25 just in case, Jim?
Absolutely.
All right. Katrina, you want to make your presentation?
I can start, but 15 minutes might be a little tight. I know you guys have a queue.
Oh, no. He has to leave. You don't have to rush it, but if he had any comments, yeah.
Let me get that queued up. All right, here we go. So this is the first page of the DPH dashboard. And here we are at the 1 year mark, basically. As of Saturday, I know our school's closed, and next week we've hit a year. So since the first stay-at-home advisory was released. So on the front of the dashboard, the state says that there's been 562,394 confirmed cases, which is indeed fewer people than currently vaccinated in our state. So you're correct on that. And there's been 16,176 deaths to date. These are the graphs of the 4 main trends. And as you can see, we've had some up and down, and we're back on a lower level. So let's zoom in on the last 6 weeks. So our state continues to do a great job with testing. We keep our testing levels very stable, which is great. And that's actually, we do one of the higher rates of testing in the United States. So this is great. The graph on the right is the test positivity for the last 6 weeks. And so that's the number of positive tests divided by the number of people who were tested. And the test positivity it dropped in February, and since the end of February and beginning of March, we've flattened out to about 1.76% test positivity. So cases are similar. Like last week, the number of cases remains just about the same as they were at the beginning of November. So we've kind of flattened out, and we're not getting any better to keep moving back towards like October, September levels. The 14-day statewide incidence rate this week was 20.3 per 100,000, but last week it was 21.3. So again, stable. That's not materially different. And so we're no longer in that free fall that we were in February. We've kind of we're holding. So the 7-day average of hospitalizations has continued to drop, which is great. We're now about 725 hospitalizations per day, and that's a level similar to about mid-November before Thanksgiving. The hospital and ICU capacity are actually similar to last week. So there's about 84% of hospital beds are occupied and 73% of ICU beds are occupied. And the fact that that hasn't changed might reflect staffing levels and changes so that they're pulling people off the COVID wards to do other things like that. So that the occupied beds fluctuates depending on our caseload, our caseload. And then the number of deaths has stabilized to a 7-day average of about 35 deaths per day. And that's similar still to Thanksgiving. That's actually pretty flat compared to last week. It was 39 deaths per day. So the decline of these cases, of these two metrics has slowed, but they are continuing to kind of tick down slower. But again, so these trail cases or cases of flattens, I'm expecting these to kind of flatten as well at this point. The one thing about the deaths is if there's enough vaccine for the older age groups who are much more likely to die, then that might actually keep going down. So hopefully that group has a large number of people who have been vaccinated in it. So that's the hope. That's why we started with them. So this is the report from the vaccine report that comes out every week. So as Jim reported, there's more vaccinations rolling out, and the J&J vaccine started last week. So that's great because we now have all 3 FDA authorized vaccines in play. If I remember this correctly, there was about 11% of residents are fully vaccinated in our state and with 2 doses or 1 of the J&J vaccines, while about 20% have received their first dose. And Middlesex County is 7.9% fully vaccinated. I haven't actually seen any data on town level, and I'm not sure that we will see it. So it'll be interesting to see as more people are vaccinated, whether they provide some information on that. So speaking of towns, let's go to Littleton. So this data I'm showing you right now is from the weekly DPH report from last Thursday. So last week we had 17 cases reported for the period between February 14th and 27th. And that was the second half of the month. And compared to 2 weeks before that, we had 33 cases. So that was a nice drop down. So that last week marked our second week in the yellow. And it was a similar number of cases as we were seeing in late October. So these are the average daily incidence rates per 100,000 for the 14-day period, tracked for all the areas that we've been following. Littleton's rate was 12.4 per 100,000, which was lower than the 2 weeks prior to that. But it was similar to the week prior. So it'll be interesting to see how tomorrow's report reflects compared to last week's, basically, is how we do it. And all the areas actually had a slight, we no longer were going on the same way. They've all kind of taken a flattening bend. So again, the drop in the trend is slowing. So it's not quite as steep as it once was, but it's still in that direction of down. And then again, this is Thursday's data. So this is test positivity for our town. The number of tests we had in our town was actually stable at about 1,300 tests. And our test positivity was 1.353%, which was lower compared to 2 weeks ago, but similar to the week prior. So again, that's a slowing of the trend. So we're no longer like dropping, we're kind of flattening back out. And across the state, there is kind of this slowing or flattening effect happening. So this is Jim's sneak peek graphed out. So Jim has reported 17 cases today. And when I look at the other towns that Neshoba Associated Board of Health cover, there were some that increased and some that decreased and some that stayed relatively stable like us. So overall for the area that Jim, the Neshoba Associated Board of Health serves, it's pretty stable at this point. So this flattening that we see in Littleton is overall effects probably similar for the region. So again, we're not going down anymore. We're kind of holding. So we'll see what tomorrow brings. Whenever Jim peeks in, it might be slightly different than tomorrow, but we're going to expect something around 17 cases tomorrow. All right, so then in terms of schools, this is the graph of the health notification letters. So this is when the parents notify the school that there's been a case. And last week we had 1 case reported. In total, we've had 38 cases reported among the school community, 30 of which were done during, reported during hybrid learning time. And there have been, so Lynn Snow reported to me today that to date, there's been 7 pooled testing days so far, and all pooled tests have come back negative, which is amazing.
That's awesome.
And across the entire state, 99% of all pools tested have come back negative, which is another really encouraging sign for these school reopenings that are coming. So really great news. Like, that's what we want to see. We're seeing, it's like you want to see the metric to make sure that you're catching it. So this is really encouraging to me. So like Jim said, elementary schools are targeted to come back April 5th. Middle schools come back right after April break at the end of April. And then high schools don't have a date yet. That will be determined sometime in April. And the school committee's agenda is quite full for tomorrow night. So there's going to be a lot of stuff discussed.
Yeah.
So we're in this state where our cases have come down and we've kind of flattened. We've reopened the state. Some businesses are reopening. There's another reopening for the businesses planned for later this month. And then the schools are going to open, or are already starting to open in some places. And yet we're at a place where the more spread we have, the more COVID can mutate and change the way it functions. So the more it mutates, more there's spread, the more likely it will mutate. And the more it mutates, the more likely it's going to have an advantageous mutation that may impact how much it is transmitted from person to person. It might make it more likely to evade vaccines, and it also might increase severity of disease. So what we're really hoping for at this point is to keep our cases low while we race to vaccinate as many people as possible, so that we can really try to not have any issues. And you might see a little guy walking behind me, which is what's distracting me right now. So the CDC and NIH have started reporting on at least 5 different variants of concern that they're worried are more transmissible. They may impact vaccine efficacy, or may also evade antibodies. So the antibody response from either prior infection or vaccines. So BU is actually doing some of this work locally. And for the 130 samples that they did the genetic sequencing for from between the beginning or middle of January to the end of February, they had 5% of the UK variant in those, but last week's 50 samples, there was 26% of the UK variant. So the numbers are small. Like, we can't really say there's 26% in Massachusetts. That's not a big enough sample to say that. But what that does tell me is that the UK variant is present and it's grown in a student body sample that they keep testing. So that's concerning. And the CDC reported that the UK variant is doubling every 10 days. And it's stuck at 10 days at this point because that's the amount of time it takes to start and end of the genetic sequencing and reporting process. So I'm not sure you'll ever get less than 10 days, given that it takes 10 days to do the whole process. So like I said before, we need to do everything we can just to prevent spread of these variants as we go through, and as we race to vaccinate as many eligible adults as possible. And the further we can drive down the cases, the quicker the vaccination actually kind of works and does its job to protect people. So this is concerning. We've got to keep our eyes out. It's really great the schools are doing pooled testing, because this will be one indicator that if there is a problem, that we'll catch it. So with all the recent and planned openings in our state, it's really important to keep in mind that there's a range of risk with every choice that we make and how we interact with the world. So the CDC released a study last week, which indicated that state reopenings of restaurants was associated with an increase of daily COVID case growth rate about 6 weeks after the change, followed by an increase in the daily death growth rate about 9 weeks later, so 3 weeks after the cases. So there's a lot of things. We've got variants now that might change how that works. We also vaccinated more people that might change how all that works. But what I am not saying, and I want to be clear about this, is that there's a direct link between restaurants and COVID cases and deaths, because that's not what that study measured. Although we know that unmasked times, such as shared meals, are higher risk. So those settings may contribute. But what I think what a restaurant opening tells people is that when those states relaxes restrictions and opens businesses and restaurants and bars and all those other things, it impacts our perception of risk and then changes our behavior. So it makes us feel safe. So we relax and we change how we act and we go do more things. And then that's how COVID spreads. And so it then starts building in communities until it can be caught by testing. So this slide right here is just to remind people that, like shown in this picture, every setting has a different spectrum of risk depending on what mitigation is available in that setting, whether it's a restaurant or a gym or a business or a school. Every layer we can put in place helps prevent spread. So even our offices and our places of employment, it's important to use as many layers as we can whenever we're around people we don't live with. And even when we're in private settings and socializing with people in private settings, it's important to use those layers as well, just to help prevent spread. So one of the easiest things you can do is improve the quality and your fit of your masks, making sure they're double layers, that they completely cover your nose and your mouth, make sure they fit snugly and there's no gaps. Those have been things that have been shown and measured to really improve the efficacy of your masks. A couple things to note is that we shouldn't be choosing masks which have the exhalation valve, because that allows virus particles to escape. I know they're easier to breathe in, but it actually doesn't capture your own germs if you have them into the environment. So it makes it riskier for those around you if you have a valve in your mask. So this is just the easiest thing we can do every time to make sure that we're slowing down the spread. As Jim touched on, tomorrow marks the last day that we use the current state system to sign up for vaccines. So visit the website and get pre-registered, and then hopefully the system works and we all start getting more supply and can start rolling it out. I did hear you can still get vaccine through CVS, and I heard Lowell General Hospital is more, it's like its own entity, so you can get vaccines that way. So it's important just to keep trying it all the different ways and to see if you can get it. And once you get your own vaccine, you can remove yourself from the state system. So hopefully this works out, and I guess we will see soon. So the other, one of the more exciting news this week was that the CDC released an interim guidance for fully vaccinated people. So the vaccines have been shown to reduce the risk of severe disease like hospitalization and death. And there's a growing body of evidence that people who are vaccinated are less likely to transmit SARS-CoV-2 to others. And this is still under investigation and measurement, but these are really promising signs. So that life might come back to normal sometime in the next few months. So the recommendations that they released this week are apply to non-healthcare settings. And as I go through these, keep in mind that households with children are considered unvaccinated. So even if both parents in a family are vaccinated, because their kids are unvaccinated and won't be for a while, that household is considered unvaccinated. So a fully vaccinated person means that they've had at least 2 weeks since the last dose was received. So that's the second dose of Pfizer or Moderna and the single dose for J&J. And fully vaccinated people can visit with other fully vaccinated people indoors without wearing masks or physically distancing. And a fully vaccinated person can visit with unvaccinated people from a single household who are at low risk for severe COVID disease without masks and physical distancing. So for example, my parents are fully vaccinated at this point, and they could come visit my family even though we are not vaccinated, without having to wear masks and distance. So that's one, it'll be really, really great to hug our families, I'll be honest. and see them again. So the other benefit of getting vaccinated is that if you have a known close contact, you don't have to quarantine or test as long as you remain asymptomatic. So if a vaccinated person ends up with symptoms, you should go seek testing. But otherwise, you don't have to quarantine for the 10 days. And for now, fully vaccinated people, according to the CDC, should continue to take precautions in public. So that means masks and physically distancing are still required whenever you're out and about, grocery shopping, all that stuff. You should wear masks and physically distance and use other mitigation when you're visiting unvaccinated people who are at increased risk for COVID, severe disease from COVID. So that means if someone has heart conditions, respiratory conditions, cancer, all those things, you should take extra cautions. Keep wearing your mask and physically distance when you're visiting unvaccinated people from multiple households. So where I just said that my parents could come visit me, my brother's family could not join us because we're two unvaccinated households together. And then avoid medium and large size gatherings and follow local gathering restrictions. And so continue to do that and go get tested if you are experiencing symptoms, because it is possible to still have COVID even after you're vaccinated. It's just more like you're less likely to have severe disease. And continue to follow guidances for your employers, keeping your distance, your mask, all the stuff that the employers and the workplace mitigation strategies, and continue to follow travel orders. And Mass actually updated our travel order today so that people who are fully vaccinated, and again, that's 2 weeks past the last dose, and who do not have symptoms do not need to get tested before arrival in Mass, nor do they need to quarantine upon arrival if they don't get tested. So the order does say that you must have your documentation, including the dates of administration, available if asked. So I want to note that this is actually different than the CDC. The CDC actually stated on Monday that they did not update the travel recommendations on purpose, and they're asking people to avoid any non-essential travel to prevent spread at this time. So this differs from the national recommendation. So we're going to leave on the cheese. So here we are 1 year when the world just got flipped on its head, and there's lots of hope and lots of changes are happening right now. You know, businesses are reopening, schools are reopening, the sun is shining. It kind of feels like the world's coming out of hibernation this last week. And these are all really great advances and signs that the finish line is approaching. It's been a long marathon, and we're coming. You can see the end of the tunnel, right? But COVID is still around, and the variants are a concern. So we're done with COVID, but it's not done with us. So it's really important that everyone continues to use as many layers of the cheese block as possible every time you're around someone you don't live with. For months now, unless they're fully vaccinated and you're following that guidance. For months now, we've talked about ways to reduce the risk, and we know a layered approach works best, and we can use it successfully. So please keep using those strategies right now, and please get vaccinated when it's your turn. And I remain worried that all the recent changes are going to change how we interact. I can actually see it happening already. So I worry that if we let our guard down too quickly and we don't vaccinate enough, we're on this like precipice of something's going to change. And it's either we're going to get all the vaccines out that we can quickly, and we're going to catch it in time, or it could go the other way. So we're on an inflection point right now. And it's really important that we as individuals don't let our guard down, especially when we're on our own time. We're in settings where there aren't any mitigations in place, and we have to make all the choices. So I know we're tired. I know we're sick of making decisions, but it's really important that we keep up the job that we're doing so that we make it to the finish line. And we're almost at the point where we can all get vaccines. So it would really be a shame to get sick at this point. So that's it.
Great. Nice little pep talk at the end there, Katrina. Way to go, Coach.
Go team.
Yeah. So can we use those slides? Can I ask them?
Anytime, yes.
Okay. And
I'll send them to you.
Looking at those numbers, I just have to look back and say, man, where would we be now today if we didn't have Christmas or Thanksgiving? You know, because those just sent them through the roof. You know,
They really did.
Yeah. All right. Does anybody have any questions or comments for Katrina?
Yes, just one. This is before hopefully before the vaccine comes in and adds more variables to it. But in your opinion, we've seen the rise and fall of cases. And have you seen anything yet that says that the following three things? I understand that you're a great proponent of cheese, and that you've laid that out very clearly. But I remain very suspicious. There's something, shall we say, that happens to the way the virus infects that seems to me to be independent of what we're doing. So that's fine to have that feeling, but I was just wondering, are you convinced, or what's your view of what has caused first the rises and then the falls? What are the major factors that contribute to each? And it's, I'm not looking for long mechanistic. It's just, is it really the cheese that made a difference? Was it our behavior, or is there something about the virus itself? Because it is very odd to me. Well, not odd to me, but there is something about the virus that has this sort of cycle, as if it's barely touched by what we do.
So I agree with you that it definitely seems to, it's very good at its job. We'll put it that way. That CDC study I touched on, where the association between restaurants opening and a rise in cases, I actually looked at the state data and our town data to say, does this kind of ring true here? And at every point where I could track the state reopening, 6 weeks later, we had a rise in cases for both our town and our region and our state. So it does ring true to me that our behavior and what we're doing is associated with spread. It makes sense. It's an infectious disease. It's what it does. So when we let our guard down, we risk cases coming at us. And I know everyone says I'm fear mongering and I've got a down look at this. I've gotten those comments, and I can understand why someone just doesn't want to listen to me anymore. And I get that. But we're at a weird balancing point right now between the number of people who are vaccinated and the reopenings that we're hitting really quickly right now. And so if we can just this all happened, in my opinion, 4 to 8 weeks too early. If we could just have held on a little bit longer, things would look different with the amount of vaccine that we'd have out in our communities. And so I really just hope people can just hunker down right now for just a little longer and not relax quite yet, because I think there's quite a possibility with all the reopenings that we might go back up.
The reason I raise this question with you, Katrina, is not to put anyone on the spot, but I'm rather struck by the experts who work in your field agree with you 100%. And they're the ones who are advising basically advising all of us that the storm could be coming again, and we should be basically especially vigilant in spite of the vaccine and everything else. Yet we're living in a state, and many people live in states, where the governors have decided in their infinite wisdom to open. So for me, there is a big disconnect. I think the thing that's most worrisome is you on another point you landed, that we have vaccine becoming available, and we're letting people out, as it were, of their restraints. And we could have ourselves having vaccinations going on at the same time we find cases going up or staying flat. I don't know how this is going to work out. But I really have problems with the disconnect between what our governor says, the governor of Texas says. I mean, we can go through the whole list, but especially our governor, because it's his board, it's the state's board of health that we're supposed to represent, are completely at odds with the warnings given by Fauci and the Minnesota crew and everywhere, and including Katrina. So I just want to express my concern. And as far as I'm concerned, I don't quite understand where Baker is getting his advice, because very frankly, the very same people who are allegedly advising him are saying something very different in the meetings that they have with other experts around. And I'll just leave it like that.
I think you're right, Mike, but I think they've been doing that right from the beginning, that it's been, that whole balancing act between the economy and keeping people safe. And I'm not saying I know the answer or that what we're doing is right or incorrect, but I think the whole year we've had a balancing act, so just a comment.
A balancing act that has killed a lot of people and made a lot of people sick.
Right.
And not just old folks, just so you know, I'm not promoting one group.
It is frustrating to me to sit here and when restrictions get rolled back, the only thing I'm left to ask everyone is to please do the right thing and use cheese. We're back to individual responsibility being what's going to change the next 6 to 8 weeks.
And there's a filter down effect when people see this, oh, I don't want to get tested. I don't want to have pool tests. I don't want my kid enrolled. It has a rolling effect. All right, enough. What we need here, as Kevin Baker would say, is more power.
Okay. Does anybody have any questions for Katrina? And go ahead, Louise.
I don't have a question for you, Katrina. I just have a comment, and I'm sorry to hear that people are considering you as a fearmonger, because I consider you as a great wealth of knowledge and being so informative and just helping everyone to stay on track and keeping us abreast of all the latest and greatest.
Yeah.
I so appreciate you coming to every meeting and doing all that. It's a lot of work, and I very much appreciate it. So thank you very much.
You're welcome.
Yeah, we appreciate it, Katrina. All right. Anybody, Janet, in the audience with their hand raised for questions for Katrina or comments?
Yes, there's John K.
So John, state your name and your address, please.
Hey, it's John Kurzwick, 171 Hartwell. Just a couple of comments. I understand the question about the, why is Texas doing this and Massachusetts doing that? And Mr. Zeldin had mentioned that it seems like there's 100% agreement about, what's affecting the rise and the fall in cases. And I would argue strongly that there isn't a strong agreement. In fact, the people out of Stanford, they published a paper saying that these lockdowns have had very minimal effect on the spread. And I think Katrina actually
John, they're on they're tilted toward the theory that the virus has certain weapons that we don't appreciate. So you're going to have to be very careful how you read those papers and what their stance is. You're not really reflecting what the Stanford study says. They are largely in agreement. At the end of the day, they're on to nuances.
Right. So I don't know if you read the paper by Iniunides, but bottom line is they looked at it and they showed no real benefit. But I want to,
John, that's not what it says. Look, I've lost my patience with. I don't mind you having an opinion, but don't reflect other people's scientific work the way you're doing it. It's just not what the paper says. It's not what any of the investigators said.
Right. I'll send it to you. You can read it.
Don't send me anything for you, because I know those guys. Okay. I know what they talk about. So please.
Right. Okay. But one of the reasons why the lockdowns aren't working that much is because Katrina hit upon it, which is she just stated that 99% of the pool testing has come back negative. Those are asymptomatic pool tests. And one of the reasons why we're walking around with masks and standing 6 feet apart for healthy individuals is we were told that there is a large fraction of asymptomatic individuals walking around and spreading the disease. We know that not to be true. Even this CDC now, their own data, they said, we showed 83 million people in the United States have had the virus, and only 10 million of those people were asymptomatic. That's their data. And of course, Ms. Hagberg's data as well. So asymptomatic spread is not as big as everybody thought it was. Okay. And I think that's the story. And then on top of that is the guys at Imperial College said there was no background immunity for this. None. Zero. They said that. That was not true. There's cross reactivity on the T cells. That's why we get the seasonality. So there is a difference of opinion scientifically, and that's why other states are opening up. And they've been able to open up safely.
Stop it. Just stop
No.
it. It's
Hey,
what
guys.
you're spewing out right now is not logical. It's not even close. I
Well,
mean,
the
I'm
proof is
sorry.
the proof is in the states that were able to open up and do it safely.
Yeah. Who opened up safely? You call Texas safe? You taught Florida safe? Get off it.
Massachusetts has the worst death rate, the third worst death rate in the country.
Okay, John, can you move on, please? I forgot to
I
tell
just
you.
wanted to give him a reason to why he's seeing these things. That's all.
Follow the CDC guidelines and the state guidelines.
Oh, I agree. Keep following the guidelines, but he was asking why there's a difference, and there is a scientific difference of opinion.
Okay,
Thank you.
thank you. Anybody else, Janet?
That's it for hands raised.
Okay. So if we don't have any more questions for Katrina, we're kind of running late for our public hearing at 7:30. You guys all set? All right.
Yeah.
Thanks, Katrina. Katrina, you going to be at the school committee meeting tomorrow to present anything, or just to be?
I apparently am on the agenda to do the metrics. Yes.
Okay. All right. I'll tune in too. All right. I don't know if I'll stay the whole time.
It's a packed agenda. There's a lot. But
Yeah.
it looks like there's some good stuff to talk about. So
Good. All right. So moving on to the public hearing of 83 Mill Road, Ted Doucette. Where are you now, Ted?
Hi, how are you?
Good.
This project made me sound familiar, and it's because we saw it before, and Jim asked during the hearing, did I notify butters? And I had a cold chill run down my spine. I knew I had notified some abutters, but I had notified for conservation. And if you remember, I don't think I was at home during the hearing, and I couldn't put my hands on it. So
That's why I was asking you where you are
obviously I
today.
realized. What's that?
I was asking you where you are today.
Oh, I'm home today.
Okay.
Yeah, I got to advertise every chance I get. So, so I did notify, I worked with, I talked to Diane about it. I did notify, I sent all the documentation to Jim and to Diane. So I hope you have it. When I talked to Diane, basically she said, or I asked her, I said, so the board basically has to open up the hearing, see if there's anybody who wants to talk to it. And then you can have a discussion if you want, or you can just reaffirm your vote. So I'll just leave it to you to take it from here. And if you have any questions from me, since anything else I'm going to say is going to be reiterating, the last request.
Okay. Jim had to jump off the meeting to go to another one. So we'll open the public hearing again and see if there's any of the abutters in the audience that have questions or comments. Janet, anybody have their hands raised at all?
Nobody has any hands raised.
Okay. So, so we were talking about, can you just remind us about what the variance was, and that we need a deed restriction for 2 bedrooms? That was also a requirement for the condition of the permit.
Right. So the variances are to request relief from Title 5, 310 CMR 15.211, which is reduce the offset between a soil absorption system and a property line from 10 feet to 5 feet, with a property line certified by a registered land surveyor, and request the offset between a water line and a soil absorption system from 10 feet to not less than 5 feet, with the water line being sealed in an outer PVC pipe. Those are the 2 that we need. And then request approval for a 2-bedroom design with a deed restriction to follow.
Okay, so still nobody else raising their hand, or anybody have any questions for Ted? And still nobody, Janet, with their hands raised?
Still nobody with hands raised.
Okay, so does anybody want to make a motion to accept Ted's variance? No, I guess not.
I'll make a motion. I'm watching Gino, so maybe Gino could unmute because he wants to make the motion. Gino, do you want to unmute?
Thank you, Mike. I didn't do that. Anyway, I'd like to make a motion to give him the variance.
Mike, do you want to second it? Or Kevin?
I'll be happy to second it.
Okay, so we'll do a roll call to accept the variance on 83 Mill Road. Kevin Baker,
Baker, yes.
Gina Fratelloni,
Gina, yes.
Louise Nichols,
Louise Nichols, yes.
Mike Zeldin,
Mike Zeldin, yes.
Lisa Flanagan,
Thanks,
yes.
Mike.
All right. Thank you.
Okay, thanks so much for your time. Sorry to interrupt. I know you guys are so busy. You don't need to be hearing things twice, so I appreciate your patience and hearing me. Have a good night.
Just want to know before you go, Ted, is that a Manchester United outfit you're wearing, or is it another team?
This is Children's Hospital Boston. If I were wearing one, it would be Everton Football Club.
Okay, I want to just get it straight. Okay, good. I can't see the insignia. I just wanted to know. Okay.
Yeah. Children's Hospital, yeah. All right.
Okay. Thanks a lot.
Good night.
Good night, Ted.
All right. So next on the agenda is correspondence. Does anybody, I received an email from somebody about a mini conference regarding cyanobacteria monitoring collaboration on March 23rd and 24th. It is in part set up for people like the Board of Health, Watershed Association, members, et cetera, to learn more about risk and communicating to others effectively. So I'll have to look into that. Sounds really interesting.
Did you ask Jim if he was going to go to it?
I did not, and Jim's off the meeting now, so I can talk to him a little bit more, but that was just my correspondence that I had.
Well,
All right.
as you prepare for climate change, I think you ought to get very familiar with the cyanobacteria.
All right. So you recommend listening in? What's the 23rd and the 24th?
I think it's like a Tuesday and a Wednesday or Wednesday. I know.
I don't know. I've got a Board of Health meeting on Wednesdays.
There
so-
are lots of books on it too. I mean, you don't have to go to the meeting, but I mean,
Yeah, no, it was just something that somebody, I think,
Sure.
a local resident recommended. That,
Yep.
So I'll ask Jim if he's going or what. So, anybody else with correspondence? Go ahead, Louise.
The temple in Groton, Stephen Gentili received the proposal from the temple. Jim sent it to Stephen, and
Yeah, Jim
so now, I'm sorry.
Jim wanted us out of the middle of it, I think.
Right, so now it's the Stephen Gentili and Russ Arena are dealing directly with the temple, so I don't know what the details are, but
Yeah, I didn't see
hope
the
it's-
appraisal, or I didn't see any of the details either.
I think it's the same as what it was before, but
Oh, really?
I don't know how the split's gonna go or whatever, but
Okay. All right. Anybody else? All right, so we'll move on to the.
Sorry, there's one hand up
Oh,
again. John has his hand up.
All right, John, state your name and address, and you have 2 minutes.
Sorry, John Kurzik, 171 Hartwell. One question and maybe this was for the public comment period, was back to Ms. Hagberg. Just a question on the where that 99% I guess negative data on the pool testing came from. Do you have a source for that? And is that something that could be shared?
So that came out of DESI's school pool testing, and I quoted it from the school's pool testing update that they send every weekend.
Is that on the Is that like on there? That's just, I'm wondering if that's something I can get access to. Is
So
that
I haven't found it myself on the DESI website, so I can't confirm it, but I know that Lynn Snow shared it as part of the COVID newsletter each week.
Okay, so that, all right, fair enough. I just was curious on where that was coming from. Thank you very much.
Welcome.
Thanks. All right, so minutes. I think, Janet, we're still missing one of these.
217.
Yeah,
I sent that to you last week. I can send it again and you can vote on it next week.
okay. So I know that Mike had a change to the March 3rd. Just some wording. And then the 20, so can we get a motion to approve the minutes for March 3rd?
Yeah.
I'll make a motion.
Go ahead.
I'll make a motion to approve the minutes for March 3rd.
Second.
Okay, and so do a roll call. Kevin Baker,
Kevin Baker, yes.
Gino Fratelloni,
Gino, yes.
Louise Nichols,
Louise Nichols, yes.
Mike Zeldin,
Selden, yes.
and Lisa Flanagan, yes. And then the February 24th, that was our retreat. That's what it was called. So anybody want to make a motion to accept that?
It was February 24th. Yeah, I'll make a motion to pass then.
Did you guys all get to read the 24th?
Yeah.
Yeah, I don't quite understand why we're doing minutes from a retreat when we're not making policy or voting.
I think Diane told me that we needed to take minutes.
So when the Board of Selectmen goes off and has their retreat, there are no minutes. But we give minutes? I'm just curious.
Who was even taking minutes?
I'm sorry?
Even when there's an executive session, there are minutes. They're just not typically made public. I don't know that a retreat is treated differently, I think, because you're all together.
Okay, I'm just curious because it's never been, the whole idea is, yeah, never mind. Okay.
Who took the minutes?
I did.
Oh, okay.
Did you read them?
I did. Yeah, everything except that I'd make a motion to approve them, except for that first one sentence on the top there where you read the open meeting, because I don't think you read the open meeting announcement there regarding this.
No, I didn't.
Yeah, so I would just take
All
that.
right. Can you take that out, Janet? Because it wasn't a Zoom meeting, and so I guess Kevin is saying.
Sorry, yes, I plopped it on with the date because you hadn't given me the date, and I'll take that.
Yeah. Okay, so we have a motion to approve the 224 minutes.
Make a motion to approve the minutes from February 24, 2021.
Okay.
Second.
Okay, and so roll call, Kevin Baker,
Kevin Baker, yes.
Gino Fratelloni,
Yes, Gino.
Louise Nichols,
Sorry, Louise Nichols, yes.
and Mike Zeldin,
Mike Selden, yes.
and Flanagan, yes. So I don't believe that I read the 17th. So nope, it's right here actually.
I don't think they do.
That's fine. I'll put it on for next week.
Okay, do you mind?
Nope.
All right. Any member comments?
No.
Go ahead, Kevin.
Just had a comment that with the schools and all the reopening, with the schools increasing capacity and density, I feel like we'll need to increase the testing to sort of get a handle on some of the source control. And so I'm hoping that the chair will entertain a motion to require any student participating in extracurricular activities including sports, especially ones that cross community lines, to participate in the pooled testing program provided by the schools.
Do you mean me, or do you mean the school committee?
I'm hoping you'll entertain a motion that the Board of Health require
Mhm.
that anyone participating in the extracurricular activities be a part of the school-provided pooled testing program.
Sure. I think that's a great idea. We continue to do the pool testing too. Do we need to get a second for this, or do I need to just talk about this at school
I give
committee?
a second. I second it.
I don't even know, Gino, if we need to should we just bring this up to school committee, Kevin?
No, I think we should vote on it.
Yeah, we should vote it. This is a Board of Health problem.
Okay.
Just want to make sure that's all. Everybody's okay.
I'm not quite sure what our, shall we say, I'd like to say yes, the Board of Health should require the testing. However, I can't help but notice that the decisions made by the school committee are made basically on recommendations that come out of the school department run by the state. In other words, it's the state education in consulting with and coordinating with the state's Board of Health. Okay, so it's the discussion about testing and its role subsequently in the opening is probably going to be a topic that's going to come up at the next, or should come up at the next meeting and of the school committee, and also will affect the logistics of how they're going to, as it were, bring more students into school, how they're going to control distancing, how they're going to carry out testing. I'm wondering if it would be, shall we say, more prudent for us to recommend to the school.
The voter, the school
sorry?
committee. You are correct, to recommend maybe to the school committee, but we would like to, advance, let them know that we are concerned.
Yeah, but I was just, when we say recommend that they seriously consider it,
Right.
and if anything else, expand it. In other words, more testing.
Yeah.
Because at the moment they're having the problem they're running into, and maybe Katrina, and maybe Kevin knows more than I have no kids in the schools and have contact with them, but it's my understanding that there is not considerable, but a statistically significant number of parents who do not want to join the pool testing operation.
Yeah.
And that's fine. I mean, they don't have to in order to be, to get an education for their children. But that's a right.
Okay. See, this is why I realize the hour's late. I don't want to start. This is a discussion that maybe we should have put aside for our next meeting, which is that when you have, and I don't want to pick on parents who do not necessarily feel comfortable for whatever reason for their children not to be part of the pool testing, but that represents a public health hazard to everyone else.
Right.
Yeah,
Okay?
and with relaxing all the other,
I'm sorry?
with relaxing the distancing, I feel like it's important to do a better job with the testing.
I agree with you, but one of the ways to do it that makes the testing effective is not just bring in more testing, whatever more means, but actually have more people participating in
Well,
it.
that's what I'm talking about.
Yeah, I realize that.
Having
That's,
these student athletes that are traveling across community lines in close contact sports,
correct.
be a part of the pool testing program.
Right.
They can help.
And if you see the directives given out by the, the school department for the state, they recognize the issues involved in traveling.
Mhm.
So I don't know if you had a chance to read that document yet that was released, I guess, yesterday or today from the Department of Public Education, I guess.
Was that the 24 pages that you sent me?
They're not my 24 pages. It's been.
I didn't say that they were yours. I just said the 24
Well, you
pages.
sent it. Okay. Anyway, yes, so they're the ones I sent you because I knew something like this was going to come up.
Yeah.
So I have no difficulty in shall we say,
Amen.
not just recommend, but strongly recommending that they consider, but, implement
Do it.
more testing
Mhm.
and put restraints on.
Well, the motion's been made and it's been seconded.
Mhm. But
Right.
you're asking to order it as opposed to recommending it.
Correct.
Okay.
Can I just ask Kevin or Katrina, because you guys have kids in school, is that something that they're proposing to do when they bring the kids back? Continue with the testing or increase the testing? Have you heard that yet?
So the schools are continuing to do everything they can to encourage more families to opt into testing and more staff too. So both of those. They, as far as I'm aware, haven't had any conversations about making different policies for participation in extracurriculars or athletics. Athletics, especially those with close contacts, like the NFL had out, there's plenty of examples of where spread has happened among athletic events with close contacts, like hockey, basketball, even in our own state. The NFL has a really detailed study from the CDC that you can follow, and there's a number of other examples. So that would be one area, especially with people, with athletes competing close contact with other people. That if, I don't know how the policies will work and whether that's even possible, but something that maybe could be discussed with the school committee.
Okay. So
I know the schools are trying to get people comfortable and to get them to opt in. They had the open forum last Friday. They've sent another webinar. I think it was done today, an opportunity for people to learn so that more people can opt in. I don't know where they are right now in the proportion of people who opted in. Last school committee, it was reported 60% participated in the second of the weeks of testing.
all right, so Kevin made a motion to recommend or
Require.
require, and then Mike is saying we should change it to recommend, but Kevin's already made the motion, so.
A second.
We can amend it, can't we? We haven't voted on it yet.
Well, that's what I'm saying. Kevin and Gino have already made a motion and seconded it. So we can either vote on it.
You can vote on it and we can not,
Can we
vote
say-
to amend it or, I don't know.
Can we say something, require it? And if the school committee is already thinking about contemplating doing that as a requirement,
Let them run with it. Yeah.
let them run with it. Yeah. I don't know. What do you guys think?
Roll call.
Okay.
They can reject it, but at least we make the motion. Maybe they realize it. We are very concerned. That's it. Let's see what happens.
Okay. So Kevin's motion is to go ahead, Kevin. Do you mind repeating it so we can get it on the record?
No, motion to require any student participating in extracurricular activities, including sports, especially ones that cross community lines, to participate in the pooled testing program offered by the schools.
Second. Even though it was second. Okay.
So are you only saying, it sounds like you're only saying students participating in extracurricular activities
Right.
are required to be in pool testing. So there's, like Katrina said, there's 60% of the kids are in it, and those kids aren't necessarily in extracurricular activities. So are you being specific about just kids doing extracurricular activities?
Correct.
I sure let them alone.
Okay. So Gino has a second. So we'll do a roll call. Kevin Baker,
Kevin Baker, yes.
Gino Fratelloni. You're on mute, Gino.
This, not me. Gino say yes.
Louise Nichols,
I think I'm going to say no to that. Louise Nichols, no.
Mike Zeldin,
Mike Zeldin, no.
and Lisa Flanagan, yes. I think that's a good idea to get the kids that are going
They
out.
might reject it. They might reject it. They might accept it.
So,
It's fine. I respect the vote. I just want to point out to you that in order for a student in school to be enter the pool testing, they need a consent on the part of the parents.
That is true.
Okay.
pool
Now,
testing.
let me just move on. The other thing about pool testing, and maybe Katrina could point out this, is that when you identify a particular group of students, that is those who are involved in extracurricular activities, you are basically opening up what we'll call the privacy issue, because it identifies who and what is who is being tested.
Mhm.
Okay, which does not encourage participation.
Okay.
Okay, so you're running up against, when you ask the school committee to vote to require them, you're asking them to violate the right of parents basically to do the consent. They have to, okay. And number two, you're working, I'm not trying to be persuasive here. I'm just trying to point out the limits at this
Yep.
point of what we can do, because other than a public health crisis, in other words, where people literally are dying and people and the town's not doing what it should do, or given a chance, or have two chances to do the right thing and haven't, nothing's happened so far. Schools aren't open yet. Okay.
Right.
But
I
we
wonder
can
if-
suggest, Mike,
Oh.
we can suggest the question is, if the school committee has a problem, they can get in touch with the attorney. That's it. The attorney will void it.
It's, I wonder if it's also required anyway. Anybody's kids in extracurricular sports activities that go over the town line?
My kids are not in that age group.
That's why I sent the document around. I'm sorry, Katrina.
Okay. So I guess it's 3-2, so I guess that it passed. So Janet, I guess, do we tell school committee that, or can they'll probably discuss what we voted on today, tomorrow. Correct? Add to their agenda. Okay. That was member comments. Anybody else? Kevin? Mike? Gino?
Oh, I did have one other comment.
Okay.
It's someone mentioned to me that there's like $50 billion earmarked to expand and continue the testing. And I just wanted to see what we could do to make sure that the pool testing does continue until the end of the school year and potentially next year as well. I didn't know how we would go about putting in an application or earmarking funds or trying to get to the
All right. I can maybe ask Mike Fontanella about funds for testing, funds to continue testing. Okay.
Thanks.
Yep. All right. Janet, any public comments? Anybody who've got their hands raised?
Yes, John Kay has his hand raised again.
Okay, John, state your name and address, and you've got 2 minutes.
Actually, I'm on the side of Mike Zeldin this time. John Kurzwick, 171 Hartwell Avenue. I think this particular motion probably should have been left open for some public debate before it was acted on. I think we're still, what are we looking at least 3 weeks away from full in person. But we just had a report that said that there's very little asymptomatic students in school. Very few. very few adults. At least that's what the pool testing is showing. So the benefit of requiring student athletes, or for that matter, kids that might be in the Tiger Club or whatever it is, after school activities, I think is going to be of low benefit. And I think there may even be some legal issues related to it. I mean, I don't know all the ins and outs of the law, but you know, that would have been my tact. I would have said, let's put it on the agenda for next week, and you know, trying to seek some expert opinion about whether or not the value was there. So that's how I would have handled it.
Thank you.
Thanks. Okay. Do you want, I know we've already made a motion, Kevin, do you want to do that? Or do you want to get?
Listen, the more people in the testing program, the better.
Mhm. Okay. Any other comments, Mike?
Yeah, I'm trying to think of mechanisms whereby we could convey clearly to the school committee that we are paying attention, very close attention, and would like to see more people, as it were, opt in for testing, and cite the fact that with the schools opening, there's going to be opportunity for more extracurricular and cross-town activity, which puts a special premium on the need to do more testing. And and convey to them that we regard this as an important public health issue that goes beyond the schools themselves. Because just because the schools are showing 90, I mean, the pool testing going, I don't know enough about, it won't try to guess what the pool testing in the schools look like, but there is a spatial aspect to it. I don't know how close they are to the norm. But let's assume everything is working. The greater community is not operating with 100%, 99% no cases. Okay, that's not, otherwise we wouldn't have this steady hum of 15 identified cases, which probably underestimates what's out there.
Right.
So, I mean, the only thing I would ask is whether or not we can, at this late hour, entertain a motion to, as it were, take a first step and convey these very strong concerns, public health concerns, to the school committee, to keep in mind that what they're doing has an impact on the town, and what the town does has an impact on them. They're not a special little island.
Yeah, they know that. I think they're taking it very seriously.
What?
I think they're taking it very seriously.
I think they are too.
Yeah. I think the guidance that they're getting, they have to adhere to, may be a little suspect, but
suspect.
But I think they're taking it very seriously, and I think they're doing a great job with everything they're up against. And
yeah,
you know, we're here to help protect public health, and that's what we're going to do.
That's why I'm wondering, you know, putting a requirement on it just opens up at this point. I don't know where they are in their, shall we say, pursuit of wider testing.
I think they're doing community outreach programs. They're trying to get people to buy in. You know, this just takes it a step further and sort of, you know, lets folks know that.
Okay, it'll be interesting to see how.
And we don't want it to come into our schools and our communities. So.
Yep. Let's see how it works.
Yep.
Okay. We all set? Doesn't look like there's anybody's hands up. Anybody have the last? Well, I guess that's it. So our next meeting will be next Wednesday, high Irish holiday of March 17th.
Oh, it is St. Patty's Day.
Gotta wear your green, guys.
I'll wear green.
And at 7 o'clock.
Motion to adjourn.
All right. Thanks for doing that, Kevin. Do I have a second?
Second.
Louise, thanks. Roll call. Kevin Baker.
Kevin Baker, yes.
Gino Farloni.
Gino, yes.
Louise Nichols.
Louise Nichols, yes.
Mike Zeldin.
Mike Selden, yes.
And Lisa Flanagan, yes. All right. Thank you, everybody.
Good night.
Good night. Thank
Good
you.
night. Night, Janet. Good night, Louise. Good night, Lisa. Good night. Oh, good night.
I just wanted to
Gino.
say, I don't know if are we still on, Dave?